Amid the coronavirus pandemic right now, I decided to do a little more research on how we can all stay healthy. By the end of my presentation, I hope to give an idea of different ways on how you may possibly get infected and provide a combination of steps and safety measures that will help on preventing people from getting sick. Keep in mind that I hope to focus especially on the coronavirus, but the steps that I would later mention would most likely be useful to avoid getting sick in general. To start off, did you know that according to the well-known historian O. Jorgen Benedictau, the disease known as the Black Death killed around 50 million people during the outbreak? To put it into perspective, the coronavirus has only killed 27,900 people as of this moment, and look at how much it has already impacted our society today. Just imagine what would happen if a disease as devastating as the Black Death began today. Luckily, the healthcare system and technology we have today is much better than that of the one centuries ago when the Black Death first broke out. While I may not be a qualified health expert, I still have some experience when it comes to pandemics. In 2003, the outbreak SARS hit my home, Hong Kong. Many people were unprepared for this, which is one of the reasons why the mortality rate in Hong Kong was relatively high, with a 17% chance of death for every person who got it. Although I may have been a little young at that time, some memories of SARS are still fresh in my mind, which is one of the reasons why I am extra cautious when it comes to diseases. How do germs enter our body? First off, many of us touch our face way too often. As you can see on the right-hand side of the slide, it has developed into a habit for many of us, and this habit can be deadly if we let it continue, especially during a pandemic. Avoid touching your face and avoid touching dirty objects because this is how germs get into your body. Other ways of getting sick include talking to someone who is infected at a close distance or having someone sneeze or cough into you. In the next few slides, I will be listing 5 safeguards to help you avoid the consequences of these scenarios. According to the World Health Organization, one of the best ways you can avoid getting sick is washing your hands for at least 20 seconds as often as possible. You will need a sink and soap in order to do this. If you do not have a washroom right next to you, rubbing your hand with alcohol-based hand sanitizer will also do the trick. It is a good idea to use the tissue paper to open the washroom door, as you may not know if there are germs on the surface of the door handle. The second thing we can do to avoid catching the virus is to stay home. If you must go out for any reason, then it is important to keep your distance from others. The World Health Organization recommends that you maintain at least 1 meter apart from others to avoid the risk of passing the virus or them passing the virus to you. Greg Gonsalves, who is a global health activist and graduate of Yale School of Public Health, tweeted an interesting picture which illustrates the importance of social distancing. Do your part, keep your distance from others, and you may save many lives. According to the CDC, another method to avoid getting sick is to clean and disinfect the area around you. You will need detergent, soap, and water in order to do this. Because you can't see germs, it's safest to assume that they are everywhere. By disinfecting the environment, you reduce the chances of you touching a surface which contains the virus on it. Areas you should clean include, but are not limited to, sinks, doorknobs, light switches, computer keyboards, or anything you touch in general. Whether or not masks protect you from the virus is still debated. However, health organizations such as the CDC and WHO both agree that you should wear masks when you are sick. This will prevent transmission of the virus from one to another. Because the coronavirus is known to be infectious before symptoms arise, you will not know if you are a carrier of the virus. It is always a good idea to put on a mask to prevent spread in case you are an asymptomatic carrier of the virus. If you sneeze or cough, do it in your elbow and not your hand. It is also true that healthcare workers and doctors should have priority when it comes to masks. However, by putting on a mask, keeping ourselves healthy, and preventing the spread, you prevent the spread of the virus to many others and are helping the doctors by reducing the number of patients they have to care for. The final step I have for you to keep healthy during pandemics is to keep updated on news. On the right-hand side of the slide is information on the number of cases in each state in the United States provided by one of the top medical schools in the world, Johns Hopkins University. In this next slide, we can see further information provided by Johns Hopkins University. As of right now, the worldwide total cases for the coronavirus nears 600,000. By the time you are watching this, it may be more, but let's hope it doesn't happen. Johns Hopkins website also provides information on the locations of cases. As of right now, there are 7 active cases and 1 death in Tippecanoe County. On the right-hand side of the slide is another screenshot of information provided by the Center for Health Protection, which is an agency in Hong Kong which provides information on case numbers and their locations. Using this information, we can avoid traveling to areas with high case numbers and stay safe. To summarize, I went over 5 actions we could take and things to avoid in order to prevent ourselves and others from getting sick. Remember that your face is the most vulnerable part of your body, so protect it at all costs. Avoid touching your face to minimize the chances of germs getting into your body. The 5 actions you can take to keep yourself healthy include 1. Washing your hands. 2. Staying home and keeping your distance from others. 3. Cleaning your environment. 4. Wearing a mask and coughing into your elbow instead of your hands. 5. Keep updated on news so you can avoid virus hotspots. By following these steps, you will be keeping yourself and others healthy, and hopefully be saving lives. Stay safe, stay healthy, and thank you for listening.